Hi, I'm Hayley. I'm a Public Health Development Officer for Cheshire East Council. I am going to be involved in the launch of the Lifestyle on Prescription tool. So what I'm going to do is talk a little bit about the rationale, the purpose of the tool, how we have piloted and developed it, and then a little bit more information about the launch and how we're going to evaluate it going forward. I will then do a separate recording of the tool so you can have a look at that and sort of familiarise yourself and learn how to use it going forward. But for now, just an introduction to what the tool is. So the plan is to launch the Lifestyle on Prescription tool on the 18th of September, and it is a joint initiative. So together, the Cheshire East Council, the NHS, and multiple care partners have all worked together to create this tool. And the primary goal is to promote people to make healthy lifestyle choices, to treat or prevent ill health in the future. So these recordings will be sent out in an email. If you do have any questions, please do use my email address. Get them questions over to me and I will answer them as soon as I can. So just moving on to the next slide. So this tool has come from the ICP cardiovascular disease workstream and it is research led. So we'll be using the COMBI model of behaviour change to sort of understand and illustrate how people do change their behaviours, what can increase motivation, for example. And what the tool does is signpost and give people information to how to make these changes. And the signposting is for either locally commissioned services or online resources, so different websites and apps that are available. And again, it is about either treating existing ill health or preventing ill health in the future. So you might be told, for example, that in order to benefit your health, you need to stop smoking or be more active. And even with all that understanding, it can be really difficult to know where to start. So what this tool does is give you several options and tell you everything that you need to know about how to get that support. So for example, if you are told that you need to stop smoking, you can scan the QR code and get a bit more information about the support that's available. Um, and social prescribers are really good at starting these conversations as well. So they may notice that someone is a smoker, for example, and start that conversation. You know, I've noticed that you're a smoker. Is that a conversation that you want to have? No, do you want to stop smoking? But I just want to be clear that this isn't a direct referral route into social prescribing. The tool itself is fantastic at giving people the information that they need in order to take control of their own health and well-being. It is only when maybe people's situations are a little bit more complex or they'd like a bit of time to talk about the choices that are available that social prescribers are there to help. And when I talk about the tool in the next recording, I will go into that in a little bit more detail. But what I really want to make clear is this isn't about increasing anyone's workload. You know, social prescribers, clinical staff, care navigators, everyone who we work with are already having these health and wellbeing conversations, you know, about reducing alcohol intake, about sleep, mental health, smoking. So what this tool does is supports you in having these conversations that are already being had. So it might provide you with a little bit of structure and something that the patients can take away with them to refer back to later, offering them that more personalised approach. And there are 4 intended audiences for this tool, and there might be crossover, but that's absolutely nothing to worry about. So the first would be the general public, those who might have a goal of feeling healthier. So they want to make some healthy lifestyle changes. The second will be those who are getting new medications. The third will be those who are receiving treatment for long-term ill health. And the last one, as this does progress, we would like to have some further discussions around how these healthy lifestyle changes can impact on elective operations. So maybe during waiting times, and then aiding recovery afterwards. So moving on to the next slide, some people may have already heard of Lifestyle on Prescription because we did pilot it back in January. That was done in the Crewe PCNs. So a questionnaire was sent out to all the professionals involved and over to Healthwatch. And generally the feedback was positive. Things like the design and the presentation was really well received. It did start a really interesting conversation about digital inclusion because it does rely on the QR codes, then sending people into different websites or online resources and apps. If you're using QR codes on a day-to-day basis, this might not be daunting, but for someone who has never seen a QR code, is unsure how they work, that can be quite a daunting thing. So what has been really important to us is that everyone who could possibly have a conversation with somebody who's been referred to social prescribing is also completely on board and up to date on how these things are working. So whether this person can then go to the library or is involved in a family hub, for example, they can continue that conversation that they've just had in the surgery. So while one person might start the conversation, that doesn't mean that the conversation is ending. So we are getting ready to launch. The launch date is the 18th of September. So right now we're doing what we're calling a roadshow of presentations, going around as many people as possible and introducing them to the tool. So I just really want to enforce that this isn't about creating more work. Long term, the plan is to create a healthier population where people feel like they have control and are they have all the information they need to make these healthy lifestyle changes. And long term as well, it may start to impact frequent flyers. We will be able to monitor engagement through the host site, so how many times the QR codes are accessed, and there will be an option to order some hard copies of the tool as well. So we'll monitor how many times that is requested. And then as this is used and starts to progress, we'd love to hear some positive stories of how when the tool was used and some positive outcomes, because we'd love to be able to share that wider so everyone gets to hear about the success. And then as we do move forward, we'd like to expand this not only from primary care, but into the dentists and the opticians as well. So everywhere you go, you see this universal branding, the same message on how to start to make these healthy lifestyle changes. And like I mentioned before, as this does progress, we are planning on introducing secondary care. So maybe thinking about the impact that these changes can have on operations as well. So I will be doing a separate presentation on the tool. So please do watch that as well. And if you do have any questions, please do let me know. Thank you.